There's a much higher chance, in my opinion, that I would have gotten that same procedure quicker if I wasn't black.
John Rivers' terrifying experiences with Canada's healthcare system started in 2017 following a spinal tap test that left him with side effects. But instead of getting the emergency epidural blood patch he says he needed to recover, the award-nominated Canadian musician waited 60 days as his health continued to deteriorate. Now he's launching a lawsuit against the hospital and urging governments to tackle racism in healthcare.
You know, the triage nurse said to me, she said, "You were here 3 days ago. I assume you are just here for drugs."
River, whose real name is Matthew John Derek Huey, was experiencing excruciating pain at the back of his head, vision loss, and lost sensation in his hands and feet. But on numerous occasions, he says he was accused of faking his pain in order to get narcotics. With his original doctor on vacation, the now 25-year-old says he visited over 5 hospitals in the GTA with no luck finding a doctor who would perform the procedure.
Where you had, you know, some physicians saying, did you just have a spinal tap? We think you need to have this blood patch, the follow-up procedure. And others saying, we refuse to do any testing, give you an MRI, give you any objective testing, because what you need to understand is this is a mental issue.
According to the Mississauga native, he was also told he was just imagining his pain and was admitted to the psych ward for 2 days. He was advised by friends and members of his community that race and stereotypes played a role in the level of care he received, and that he should avoid dressing a certain way, for instance, not wearing baggy clothing. On one terrifying day, his mom would go to extreme lengths to ensure what he was wearing wouldn't negatively impact him.
My mother was trying to fasten on a button-up shirt to my unconscious body on a stretcher.
Racism in healthcare has been acknowledged by medical professionals, governments, and advocates. And one expert says River is no exception to a system that is fraught with racial bias.
On the surface, what it looks like is that wasn't a life that was valued. That was a life that was dismissed. And that's the experience that many racialized people are having.
John's family shared his story on social media, and fellow Canadian artists threw their support behind him. He credits their support for helping him get treatment in February 2018.
What scares me the most is that I know that there's a million other kids who are not rappers, a million other rappers who do not have the following that I did.
Later on City News, the initiative some medical experts want hospitals to implement that Toronto police are already getting ahead on.
Had I not been black, there was a much higher chance I would have gotten better treatment way earlier.
Every year, millions of Canadians walk into a hospital or clinic to get treated, but as healthcare professionals themselves will tell you, not everyone gets treated equally. Studies and anecdotal reports have demonstrated how racism has impacted the level of care racialized communities receive. And John River, who you heard from earlier in the show, is just one example, and his story isn't unique.
Following complications of a spinal tap test, John River visited over 5 hospitals in the GTA, looking for a doctor who would perform the emergency epidural blood path he needed.
Well, on day 30, can I get some help? It's not that bad. You're imagining it. Prove it to me.
He was experiencing extreme pain, vision loss, and lost sensation. But instead of getting help, the 25-year-old says he was oftentimes accused of faking his pain to get drugs or imagining it. It took 60 days to get that emergency procedure, and now that he's recovering, the Mississauga native is telling governments to tackle racism in healthcare.
I know, and you know, that in 3 months, there's going to be another young black man who walks in the hospital, and the exact same thing is going to happen to him that happened to me.
Notisha Massakoy, a health equity consultant, says Canadian healthcare isn't responsive to black communities' needs, adding inequalities have long been documented.
Racialized populations, in particular black populations, are having the worst experiences in the healthcare system, meaning their issues aren't being addressed fast enough, timely enough, appropriately enough, and therefore we're having more premature deaths. We're having higher rates of illnesses that should be preventable.
A few years ago, some local healthcare professionals started collecting race-based data that could help to determine patients' needs. But Massakoy says this is voluntary.
If we don't understand specifically what health experiences Black communities and racialized communities are having, we're not going to be able to treat people effectively. We're not going to know what are the major issues, what are the health disparities.
The Ministry of Health and Long-Term Care notes though Ontario mandates the collection of race-based data in other fields, healthcare isn't included. Quote, health information custodians, including hospitals, are not included in the Act due to patient privacy considerations. That said, race-based data is collected at some hospitals in the province at point of care through the We Ask Because We Care survey.
What I would say needs to happen is now the political will to maintain that process, as well as the ongoing training and the mandating of it.
Now, there is more to this story. For a more in-depth look at John's health journey and to learn more about other initiatives underway to tackle racism in healthcare, you can head to our website, citynews.ca.